Hello, I'm Rico Caviglia, and this is my co-host John Jew. Say hello, John.
Hello, Rico. Hello, everybody.
Well, welcome to this edition of the American Wellness Revolution Show, where it's all about transforming America's health crisis. So, thanks for being here and supporting this critical cause. So, John and I have teamed up to first let you know, make sure you're aware of the crisis that we're having and how it happened and what you can do about it. And it's not only a crisis for our health, but we really have a crisis in our health insurance as well, which is really sick care insurance. So this is going to make a really big impact on your life. So today's show, we're mostly John's going to tell you about this exciting new way that not only can you save a lot of money on your health insurance, but how you can get involved and bring a lot more wellness and prevention into your life as well. So in previous shows, we talked about exactly why we're having this problem, both as our chronic illnesses and also how the health insurers are all about how much money they can make, not about your health. And so these are two critical issues that we're addressing, and we got some great solutions for you. So, John, let's get right into it. I know you got some new information, new excited. I know you're excited about this, how this is going to make a huge transformation in people's lives. So let's just start again. Just to start with the problem of poor health and the financial instability that it's creating.
Yes. Thank you, Rico. We're talking about a $4 trillion cost that we are up against here. Sacramento, and that's where I'm from. You're from San Diego. I think this can work in every community because everybody is experiencing what we're going through. Sacramento mirrors the nation's health and financial struggles, skyrocketing premiums, declining wellness, and over reliance on profit driven systems. This dependency has created what we call a new word, insurism. Insurism. It's
I
a
like that.
mindset where people give up responsibility for their health to external entities that profit from sickness. Insurism. Remember that word. The result, what happens here is a community weighed down by chronic illness, debt, and loss of hope.
Yeah, really well said. I just want to add what the sad thing is, people have just bought into this, that's just the way it is, and that's the only thing they can do. So if you buy into, just like we talk about, if you buy into that you're going to get old and sick and die too young, that's what you're going to create. So again, if you just buy into this, that you have to get this expensive health insurance, and that you probably are going to get sick and need all these drugs and surgeries and all these things, then you're stuck. That's what you're going to create. But there's a new way to break out of that. So yeah, go ahead, John. I just wanted to add
Yeah,
that.
what you're saying, Rico, is so true. Is that way of doing things is so normalized for our society is that we're just going to, as we age, we're just going to get sicker, we're going to get unhealthier, we're going to be on more medications, and people think that is normal. That's what happens when you age. And that doesn't have to be. And unfortunately, I would say, and you know numbers better than I, Rico, that's probably 90+% of our population, especially as we age, they think that way. And it doesn't have to be that way. So, yeah, we do have a solution. We do have a solution. And it's something that is new to the marketplace, but not really. It's been around for 40 years. Is our health insurance is really not doing the job for us because it's a profit model. What we have is a nonprofit model, and it's sharing the communities. The problems of our health can be shared by the community rather than the health insurance companies and the people who are paying for our health care, our inflated health care that is just so profit motivated. And impact health sharing is the nonprofit that we are really closely associated with, and its time is right now. And the reason why I say that is because of technology. What we can, because we're nonprofit, we do is we don't have to do all the marketing that costs millions and millions of dollars to all of our healthcare industry people. We don't have to do the profit sharing with our shareholders. We don't have to pay our administrative fees and all the billing that's going on. We don't have to do any of that because technology will take its place. And when you take the profit model, the profit that is being in the trillions of dollars out of the equation, then all that money gets returned to the people. And what it does is it means lower premiums. In fact, I'm going to compare, even though we're not health insurance, what we are is health sharing. It's the community rather than the corporations is what who's sharing in all these things that are going on, and that also includes wellness. So
Yeah.
so
Yeah.
it's really a good model.
Well, also, I just want to ask too, and share again, we want people to understand that we don't really have a healthcare system. We have a sick care system. They're not trying to make you healthy. They're just they're or keep you healthy. They're trying. Our system is set up so you get sick, so they can make a big profit. So we really have a sick care system that tries to do something for you. Although most of their methods are not only non-effective, but they can be downright dangerous, and and just the astronomical cost. So that's why we have to change this whole mindset. We have to change this whole system. And as you've been saying, as you're going to get into it more, impact health is not only about saving you money, but also helping to understand that we can shift from a sick care system to a healthcare system where we can learn to prevent a lot of these illnesses and learn how we can be healthy. And that's another way how the premiums can come down, because the people who are going to get involved with impact health sharing are going to learn and already know that they want to be healthier, and they're willing to take responsibility for their health so they can live a lot healthier. So isn't that true, John? So if the majority of people that are in impact health sharing are into creating better health, not only is that going to really improve their life, but it's going to make everybody's uh, health sharing a lot less expensive.
Exactly, exactly. Impact health sharing represents a divine redirection from dependence to empowerment, a nonprofit model that returns healthcare to its original purpose, people caring for people. For over 5 years, Impact has proven that a community built on transparency and shared responsibility can thrive. With over 20,000 now, 20,000 satisfied members, Impact is ready to scale to much, much more 20 million people, 50 million people. They can use this, bringing up to 50% savings compared to traditional insurance while giving members the freedom to choose their own providers and pursue true wellness. This is more than a financial solution. It is God's model for stewardship, compassion, and wellness, calling each of us to take part in His design for thriving, healthy, purpose driven lives.
That's well said. Well, let me ask you, John. And right now, our traditional health insurance, you're pretty much stuck with the providers, the mainstream medical doctors that they offer to you. So with impact sharing, are we going to be able to also contact uh, more what so-called alternative healthcare practitioners like functional medicine doctors and naturopathic doctors and this sort of thing, and acupuncturists? Are we going to have more access to this type of wellness practitioners?
Absolutely. Absolutely. You can stay with your same doctors in the healthcare system that has not worked for so many. And you can also branch out to pick your own provider. And if that's a functional medicine doctor, a lifestyle type organization with a doctor who says, I believe in inner healing. I believe in you. I believe that we are all designed on this planet to not have toxicity going into our bodies with all these medications, all these surgeries. Absolutely. You can pick your own doctor if you believe in that.
Yeah, that's a big plus. And again, back to the financial issue. Uh, the treatments, from natural healthcare and natural medicine and functional medicine is a whole lot, not only lot more effective, but it's a lot less expensive than all these drugs and surgeries and things that the mainstream medicine offers. So that's another big plus.
Yeah. What a concept is that it's actually cheaper and less expensive to live a happier, healthier life.
Yeah.
Yeah,
Yeah.
that's a crazy thought.
How about that? Yeah. Well, it's just like I like to tell my clients, John. My wellness clients. Some people complain about eating organic food. It costs more money and all that. And I think I've told you this before. Uh, but when you get a lot healthier, you're going to have a lot less health care costs. Remember, I told you I have a doctor friend. When he tells his patients they need to eat organic fruits and vegetables, and they complain about it costs more. He says, "Well, have you checked the price of cancer lately?" Yeah. Yeah, there's so many information that we need to get people to make them understand. As you like to always say, it's a big mind shift of what's really possible in our life and how far off balance and how far off of the way how things could be. So it's a really important to get all this information out to people so they can realize that there's a lot of good alternatives that are going to beneficial people not only financially but physically as well.
Yeah, and I don't mean to laugh, because cancer is a serious chronic illness that is, our healthcare system says basically no cure, but the cure is always within us. That's where the miracles happen, is a belief in the way we were designed as human beings, that those 40 trillion plus cells that we have in our body is the best way to actually heal. And that concept doesn't hold for certain profit models, because there's no money in
Yeah,
healing from yourself.
yeah,
They don't get paid for you healing yourself. So that's what we're up against too. We're talking about concepts, and that's why we're talking about choices too for better health and better wealth.
yeah, absolutely. Well, let's talk about. I know you live in Sacramento, and you've been starting to talk with the city council there, and it's like a national movement of how how city and city governments can get involved and to solve these big health challenges. So, talk a little bit more about that and what's your plan, how you're contacting these city governments.
Yeah, thank you for that. Yes, I actually have talked in front of the mayor and our city council, and it is a process because it's a mindset shift that people have no way of knowing that this is out there in the universe being offered. 98% of the people really don't know what we're talking about here, Rico. And what is also happening to our society is a lifestyle is a very foreign concept to people too. They say, "Oh, it takes too much work to live a thriving um, lifestyle that includes exercise, includes proper sleep, it includes stress management, includes eating the right foods. It also includes avoidance of toxic substances, and then the very final piece of this, because you and I both teach this, is social connection. And this is impact health sharing is all about community. It's all about supporting others. In fact, as we age, I know I and you let us know this, is that as we age, one of the biggest things that we suffer from is loneliness and not having a community, because our friends are dying off. Our illnesses, our chronic disease, whatever it is isolating us from the population. And so what's happening now with the loneliness part is now you have a community. You have a community of people who want to take care of each other, just because that is the concept. That is the way it works. It's a nonprofit, people helping people. So that's the real cool thing about what we're offering here. So cutting edge, so innovative, but it's been something that's been long overdue, and now is the right timing.
Yeah, it's on that same topic of community. You probably heard of the blue zones, and one of the blue zones are areas and communities all around the world where the majority of the community does stay healthy and live to be well over 100 and are still healthy and can take care of themselves and function well. And one of the big reasons is because they have a tight knit community. They help. They take care of each other, and they help people to stay well and healthy. And so again, that's that's a major thing that we're beginning to start here now in the United States. We got so far out, you know, out of connecting with our neighbors and our community, and we definitely need more of that always, and social connection and wellness connection, and how we can support each other and all these things. And there's so many of the challenges that we are facing in America. There's too many of them even to talk about right now in this show. There's so many of them, but so many of them could be solved if we form strong communities that can get together and on that level, because our governments aren't going to do it. We already know that our government is barely functional. It's pretty dysfunctional, and it's not really doing things that are helping people on the day-to-day basis in these small communities. So it's all about communities, and impact health sharing can be a big part of that.
Yeah, that was well said, Rico, because community is what we are all about. We are social beings. And when we're going through all the problems and all the health issues that we go through today, is there's a lack of compassion for each other because we're just so involved with just surviving, is that community is lost. And that's what we can do, is when we're all working towards a common goal, and that's wellness. And that's what God designed us for. It was this loving, joyful journey that we were all gifted by God to be on. And so this is what it's all about. So yeah, I wanted to give you a quick update how this is working in Sacramento. It's going to be presented to the city council again. And what they're going to do is they're going to understand that what's their next step. And this can work in every community. This can work in every community. In fact, I'd be very happy to, because this is the initial phase of this, is to go out to those communities and actually talk to the mayor, talk to the government officials who really understand what we've got here. Because if they just continue the way they're going on, our businesses are going to close up. We're going to have, all kinds. Our hospitals are going to be crammed with sick people and broke people. It's going to be a tough way to go. That's the picture that is being painted right now. And luckily, we have impact health sharing in a nonprofit model that is for the people. So what I'm going to be doing is I'm going to be speaking in front of the mayor and the city council and let them know that we can reach businesses. We can reach those business owners who are actually giving the benefits. And this is one of the biggest benefits in businesses today, is their healthcare program, that is for their families. And now employers cannot offer this to their employees, because we're going to be looking at not only an 18 to 20% increase that has already been announced, well, here in California, but it's across the entire nation, is when these subsidies, and that's why our government is shut down right now, they cannot agree on this, is our government is really taking away those subsidies right now. As of December 31st, it's going to be another 50 to 66% increase here in California alone. I've heard in Pennsylvania it's going to be as high as 75%. I mean, that
Wow.
is unbelievable that we can actually hear this, but it's going to be put into action. And us being the way we are as a nation, we're very reactive and not proactive. What we're talking now is something very proactive that is not only going to make your life easier, but it's going to take you down a path of wellness rather than unwellness.
Yeah, I think, I mean, already there's a lot of small, medium-sized businesses that can afford even to pay the healthcare costs for their employees. So it's putting a lot of small businesses actually out of business. So this is going to be a big boon for small business. And I was just thinking, of you're saying that, John, cities, they have lots of employees. So they need to take a look at this, how they can save money, on their healthcare costs for city employees.
Yes, that's absolutely right. And I'll give you just some real quick examples of what we can do right at the health sharing level. And I'm going to compare it to our current insurance premiums. Right now, the average cost.
Oh, so
We're okay now.
get it
So
wrong.
what it is $2,500 a month is where our health insurance is asking for premiums with a usually it's about a $7,000 deductible. Okay. And I'm going to compare this real quickly and real easily is with Impact Health Sharing, same doctors, same providers, everything is the same, except you can actually add on the doctors that you would like to, use instead of the ones that are being in the system. And that same premium, $2,500 premium, will be $650 with a $2,500 deductible, and that's for the entire four people in the family. But the numbers just keep getting better and better depending on what we can do for you, what your situation is in each household. So it's amazing, and you can actually some of these employers can actually add on because of our healthcare costs, they can actually offer benefits to employees where they couldn't offer them before because it was unaffordable. So that's another big time advantage. So it's a learning period for everybody. It's a process, but this is upon us right now. This is an urgent need that needs to be addressed, and it's going to be addressed right now. And we can do this. People can enroll in this whole system. It's really easy. It takes them 15 to 20 minutes, and we can Impact Health Sharing, because they're a nonprofit, they're here to help you. And it's just as easy as enrolling online, 15, 20 minutes, or you can actually make a phone call and they will enroll you right there on the spot. So,
Well,
it's very transformational is what we're doing.
yeah, that was my question. My next question, John. What people? Hopefully, our audience is getting engaged and they see the benefit of this and they want to get more information. So let's give them some action steps that they should begin to get involved, like how they can endorse this and how they can recommend other people and business owners and kind of go through these steps that people can take now.
Yes, we'll have in the notes, we will have a link, and all they have to do is just click that link and they can get a free quote. Plus, it'll tell you everything they need to know about impact. But basically, we're telling you right now that this is a concept that is here to stay and it's going to be growing like crazy. So, we have all kinds of informative ways to learn more about this. But know that the bottom line is we're nonprofit versus a profit entity that we're up against, and we're all about sharing through the community a path to wellness for each one of us.
Yeah, really well said, John, and thank you for all your efforts in getting this information out to people. Well, we're just about ready to wrap it up. So I also do want to let you know that in addition to how how we really want you to check this out and how you can save and get involved with this movement of impact health sharing, but also that again to let you know that John and I we're here to help you with your own personal wellness programs, and that's what we do. So first of all, I want to let you know just for being here today, uh, I have a free gift for you. I think it's a really valuable one. I want to offer you a copy of my ebook, Real Nutrition Real Fast. It just breaks it down in really easy, simple steps how you can really take control of your nutrition and how you can eat well, and it makes it really simple for you. So again, we'll put that link in the show notes. You just got to contact me and I'll send you a copy of my book, Real Nutrition Real Fast. And then also we'll put a link. You can take our free aging assessment to find out how well you are aging. And like I always like to say, if you don't like the results, you can book a call with me and we'll just have a friendly conversation. We'll discuss whatever fitness or health or nutrition or whatever challenges you may be having, and I'll give you some quick and easy solutions to get you going on the right track. So I want to let you know too that we're here for you to help you out. We have coaching programs available as well. You can find those on our website, and so we're here to help you in every way that we possibly can.
Rico, I'd like to interject too. Is you've been a fitness trainer for 45 years. You know the path to help people get well and to be fit and to really know their own bodies, their own mental state as far as that goes. But what's really has changed now is, let's just say somebody's got $1,000 premium that they're paying, and we can bring that down to $400, $500. That extra money can actually be used for something like your coaching, which is not definitely not that your coaching is priceless. That's the way I look at it. But whatever that cost is, we can really interpret and really transpose the money that you're saving into something that is going to bring you down a healthy path. And so this is just double your pleasure as far as what you can do. It's really good. And then another thing that we do have is we have $150 allowance. Any impact member is $150 a month that will be taken off of your deductible for a wellness program. It can be acupuncture, it can be physical therapy, it can be massages. Anything that looks like it's going to help you be healthier is taken off as a $150 allowance. So everything that we do here is directed towards your wellness.
Well, I think that pretty much wraps it up and says it all. So again, we urge you. Again, I always like to in all my interviews and shows with, we always want to bring you some great information and some wisdom. But if you don't take action on what you learn, nothing happens, right? So knowledge without action is useless. So take action. We're here to give you some trusted information that really can transform your life. So we'll give you all the contact information. So we look forward to contacting with you and being here for you and help you in every way that we possibly can. So we look forward to working with you and let's meet up soon. Let's talk. Let's see how we can work together. And so thank everybody for being here. And any last words, John?
Yes, you can see I'm trying to get that last word in, is the call to action. You just said it, Rico, and that's perfect. Is we will put in the notes not only, how you can learn more and enroll if you like, but what we're also going to do is we have 30 questions that you will probably have, maybe 3 or 4 of them, 5 or 10 of them, whatever it is. We've got 30 questions with a quick answer that's going to give you everything you need to know about where we're going with all of this. So just know that this is the face of the future as far as us being healthier and wealthier as a nation. Thank you, Rico.
Yeah. Well, thank everybody for being here
Thank you.
and go out and become your best self and help to make it a better world for everybody. Thanks a lot, everybody.
Thank you, everybody.